Okay, yes, I'm a senior citizen, live in Temple Hills, Maryland. Now, I'm gonna tell you the thing that really concerns me as a retired person. You've got illegal people in the county. I'm having to pay for them. They don't have insurance.
Right.
So what's going on with that? Something needs to be done about having to pay for people who don't even belong in this country, who are here illegal, and people that don't have insurance. I mean, you know, I'm really concerned about that. As a retired person, I don't want to do that. I don't want to do it.
Let's look at what the legislation does, because in the legislation, whether you're looking at any of the bills in the House of Representatives or in the Senate, all the bills say, all the legislation says is that we will end up covering 97% of the public who will be covered by health insurance. The 3% that will not be covered actually form the population of undocumented workers because they won't fall into the system. Now, we actually could disagree as people hear about whether that should be true. I'm just telling you what's in the legislation. And so the notion, and now will it be true that there might be people who are drawing on the emergency room services or other services because we don't have, when emergency room doctors are treating an emergency, I'm guessing that they are not asking about whether a person is documented. I actually happen to believe that if an emergency room physician is treating a life or death emergency, that should not be the first question.
That's right.
But I will say to you that the system and the legislation as it's envisioned don't incorporate the concern that you've articulated. And I hear your concern, but there's nothing in this legislation that, and much to the consternation of an awful lot of people, there's nothing in this legislation that requires taxpayers or those who have insurance to pay a bill for undocumented workers.